Hi everyone, my name is Haley Prieto and today I will be giving a brief presentation on the drug acetaminophen, also known as Tylenol. I will be talking about what it is used for and how it works in the body, and about proper dosing and safety precautions. A little bit about the history of acetaminophen. It was first synthesized in 1878 by Harmon Northrop Morse at Johns Hopkins University. It was first clinically used in 1893 by Joseph von Mering, and around in the 1950s, it started to become advertised in commercials under the brand Tylenol, which is very popular today. How does your body metabolize acetaminophen? When we take acetaminophen, the liver breaks down by using three main pathways. Most of it is processed safely through glucuronidation and sulfation, turning the drug into harmless substances that the body can eliminate. A small amount forms a toxic byproduct called NAPQI, which is normally neutralized by the body. But if someone takes too much, NAPQI can build up and damage the liver. What is acetaminophen made of? Chemically, acetaminophen is made of carbon, hydrogen, nitrogen, and oxygen. The chemical formula is C8H9NO2, which contains 8 carbon atoms, 9 hydrogen atoms, 1 nitrogen atom, and 2 oxygen atoms. The molecular weight is approximately 151.16. What is acetaminophen used for? It is most commonly used to relieve pain, but can also be used to reduce fevers. It is often used when people cannot take NSAIDs, such as ibuprofen or aspirin, due to stomach issues, and can also be found in cold and flu products and prescription pain medications combined with hydrocodone and oxycodone. Some of the ways it can relieve pain include headaches, muscle aches, back pain, toothaches, menstrual cramps, and minor arthritis pains. And for reducing fever, it can help with common colds, flus, and infections. How is acetaminophen used? There are several ways to take acetaminophen. The most common is orally in tablets, capsules, or liquid form, but it can also be given rectally, and it's often given that way for children who can't swallow medicine or have issues with vomiting. But in clinical settings, it can be given intravenously or through an IV. Appropriate dosages depend on age and weight for children and infants. Dosing is based on body weight, usually in liquid form. For teens and adults, the dose is measured in milligrams, with strict limits on how much can be taken per day. Taking the correct dose is very important to prevent liver damage. For adults and adolescents 13 or older, body weight of more than or equal to 50 kilograms, the recommended dosage would be 1,000 milligrams every 6 hours or 650 milligrams every 4 hours. The max daily dosage would be 4,000 milligrams. For adults and adolescents 13 or older with a body weight of less than 50 kilograms, the recommended dosage would be 12.5 milligrams every 4 hours or 15 for every 6 hours. The max daily dosage would be 3,750 milligrams. Toxicity and overdose. An overdose occurs when the liver cannot safely process the amount of acetaminophen taken. Safe pathways get overwhelmed and more of the drug is converted to NAPQI. If glutathione, the substance that neutralizes NAPQI, runs out, the toxic byproduct builds up and damages liver cells, which can lead to serious liver damage. Some precautions to stay safe is to never exceed the maximum daily dose Avoid alcohol because it increases liver risk. Always use the correct dose for children, and don't use acetaminophen long term without a doctor's guidance. Space out doses properly, usually every 4 to 6 hours. Common side effects include nausea, stomach upset, loss of appetite, headache, rash, or itching. Less common side effects would be allergic reaction, hive swelling of face, lips, or throat, difficulty breathing, changes in liver enzymes. And serious side effects, liver damage symptoms, upper right abdominal pain, yellowing of skin or eyes, dark urine, severe fatigue, nausea or vomiting that won't stop, kidney damage. During pregnancy, short-term acetaminophen is usually considered safe and is recommended first-line pain reliever. Always use the lowest effective dose for the shortest time and consult a healthcare provider before using long-term or late in the third trimester. These are some of the sources that I used to research on my presentation. Thank you for watching, and I hope my presentation teaches you a little bit more about acetaminophen.